Hello and welcome to this Better Business Bureau Building Trust in Trying Times webinar. I'm your host, Dale Dixon. So good to have you with us. These are live for BBB accredited businesses, and we do record these and post them to our YouTube and Facebook pages so that you can go back and watch the information and available to everyone. We work to make these webinars as interactive as possible so that you can interact with our guests and ask questions. You'll see that there is a Q&A box at the bottom of your Zoom screen. If you would use that to ask questions and also be reading those questions, and if you see a question that resonates with you, you can hit the upvote, hit that thumbs up, and the more those questions are upvoted to the top, the faster we get to them and answering those questions at the end of the webinar. Today, we're focusing on creating a plan for your business to reopen, both from the tactical side of what needs to happen in your business from a safety and health standpoint to the communication side. And how do you communicate with employees, with your vendors, with your customers, anybody involved with your business? Very important topics as the business communities in a number of states prepare to reopen. So our guest today, number one, Jessica Flynn with Red Sky Public Relations. Jess provides strategy and ideation across the client portfolio, also leads the agency's executive skills coaching and training programs. With more than 2 decades of journalism and PR experience, she is a trusted advisor to private and public sector leaders who turn to her to handle high-stakes issue communication and crisis response. Also, Abbey Abbondandolo. Abbey has spent 32 years with the Houston Police Department, most of them as a homicide detective. Now he is director of security with St. Luke's Health System. And if he looks familiar to you, he also moonlights as a consultant and a star on Oxygen Network's Cold Justice. With that, I am going to turn to Abbey first as we talk about the plan that needs to be put in place from a health and safety perspective for a business to reopen. Abbey, with the hospital system, you have obviously been dealing with people through this and learned a lot. Take us through those things that you've learned that a small business can think, oh, I didn't think of that, but I need to be considering that as I open my doors to the public.
Well, thanks, Dale. I appreciate it, and thank you for the introduction. These are much different times than any of us have experienced. So St. Luke's as a health system has learned a lot in terms of turning things around very quickly to make entry into our hospitals for our patients and our visitors safe. It's a difficult process, but we've had the opportunity to learn a lot. So I'd like to talk about some of those things that we've learned, where we were successful and where we had some opportunities to do a little bit better. One of the things that we found in order to educate all of those entering our hospitals during this concern with COVID-19 and keeping everyone safe is to communicate
We just lost Abbey's voice and picture. I'm going to let him figure out how to get back into the webinar. And I'm going to turn to Jess Flynn, who is talking from a communication standpoint. And Abbey, as soon as I see Abbey starting to come back online, Abbey's now connected. And once Abbey unmutes his microphone, should be able to jump back onto, we're still running with those technical difficulties. So Jess, let's talk about the communication aspect as Abbey comes back online. As you've been advising businesses through this process, especially thinking about opening up, what does a business need to be considering on the communication front?
Well, first off, and I think this is going to be something that Abbey will also address, is how is your business aligning with the regulations and guidelines of your city and your community and your state? And as we've seen, yes, there are the CDC guidelines, but then each community and each state is rolling out different phases for how businesses are going to go forward and reopen. And so consumers and clients and partners are really looking to businesses to say, how are you aligning with those regulations and guidelines? And then also, how are you changing your operations to protect not only me, your customer, but your own employees? And so customers are looking for that information, and they're looking for it in so many different ways. So it's on businesses to really make sure that the plans they have in place are being clearly and consistently communicated on multiple different channels. And this is not to say they need to be standing up brand new websites or jumping on social media platforms they may not be on. It's even basically saying if you have a phone system and an answering service, making sure that your message on there can direct people to where they find more information. Making sure it's on your website or even posted on the front door if you are a Main Street business and a retail operation, so that when people are demanding that information from you as they're trying to figure out how to patronize your business, they can easily access that.
So you've also have some really interesting reminders for a business and a framework for a business to think through the communication side.
Yeah, I'll go ahead and share that. And this is one of those things called a mnemonic, and I cannot even pretend to spell mnemonic, but I think it's super helpful for all of us to think through, because it really encapsulates the fact that we need to be leading with both confidence and specific details, but also with heart and empathy. So the framework is called the HEART framework. And this was something that Harvard Business Review was actually highlighting, and it really emphasized to me a lot of the things that we teach with crisis communication for businesses. And we are all, whether we really want to acknowledge it or not, in the midst of what we would call an ongoing or rolling crisis, that we are constantly having to be nimble in how we communicate. So the HEART framework says, number one, you need to really be thinking about how you are humanizing your company to your customers and your clients. So that is acknowledging that we are seeking empathy and connection from those people that we're looking to for information. So business leaders of any kind, our elected leaders, we want to understand and recognize that they know the human impact of this on us and on their employees. So humanizing your company and your communication, letting people know that you're taking care of your own people and you're looking out for them. Then E is educate about the changes. This is going to continue to involve and change the operations of every single business. So constant education and sharing that information about how your operations are having to change and adapt, particularly as we go through these different phases and stages of opening. Assuring your audience and your customers that you have stability in your operation. And for some of us, that may mean we've had to scale back certain offerings based on restrictions or finances, but being direct and honest about that can help engender that trust. It's also giving us an opportunity to really revolutionize the offerings that we present and provide to people. I would say to the restaurants out there, a month or two ago, those that were able to do pickup delivery or curbside delivery, these are things that they had never even been potentially considering before. But necessity is the mother of invention, and it's really giving businesses this opportunity to look at, how do I meet clients and customers where their needs are and protect them and ourselves? So really showcasing how you're revolutionizing and adapting to provide products and offerings when they need it. And then the T stands for tackling the future. And that is looking ahead to what's going to happen in the next month to 2 months. Recognizing that things are going to adapt and change, but in your best planning, when do you see returning to having in-room dining or providing services within people's homes? Letting them know the path forward so they can also have a framework for how they interact with you.
Fantastic. Jess, thank you so much for pinch hitting right there. And thank you as an audience for adapting as we've had a few technical difficulties. Abby's back with us now. So our hope was to lay this out as craft the plan for what needs to happen inside your business, then communicate it out. So as long as you at home or in the office are working with us through this, we're going to jump back over to Abby and talk more about what you learned in the hospital setting, dealing with people, that translates to what a small business can expect when that small business opens up.
Well, clearly, one of the things we learned is the ability to change quickly and on the fly, which is what I just did here. So I apologize for that. So some of the things that we learned, and I can say this without any question, is our ability to communicate to those entering into the hospital. And that's going to be the same way in every business right now, is explaining to those customers, those folks that are walking in, what the expectation is, what they should expect, and what you can expect from them. So I can tell you in the hospital setting, we really struggled with the amount of signage, and because it becomes overwhelming very quickly. So we have the right people at the front door of the hospital to greet people and to provide them with some of the instructions. No different than when we made the drastic change with TSA and you getting on an airplane, is explaining to them an in-person conversation about, this is where we want you to stand. We expect you to have a mask. These are the steps that we're going to take. We're going to have someone cleaning all of the high touch areas constantly while you're in our business. You're going to see that. And preparing for those things. One of the things that you may have seen in grocery stores, and we struggle with entering into the hospital for our visitors and our patients, is how far is 6 feet away? I mean, that number is a recommendation that we follow. It's a CDC guideline. We have that mapped out on the floor with red tape, and we have people helping our visitors and patients understanding where that 6 foot is. And I have to tell you, when you enter the hospital, of course, we have surveillance cameras everywhere, and we've reviewed that video to watch our customers enter in, and that changed the way we did some things because we could see some of the frustration. So lining things out, having someone go up and explain to them, and being prepared for that person to be upset with you and uncomfortable with the process. I think having that discussion with the staff that you're going to have there on those first few days and first few weeks to understand, don't take this personal. People are going to be upset, and we need to be accommodating within the guidelines that we're going to work with. And I think coming together as a team, for your team, to be very open about that, so that when folks do come in, you can explain it, and perhaps even a little de-escalation training for your staff to recognize people are going to be anxious, people are going to feel uncomfortable. How do I de-escalate when the person that's coming into my store or into my business feels uncomfortable? Because let's face it, we're all a little anxious right now.
So Abby, I've got to ask, because I know your background in law enforcement, what are just one or two things that a civilian can do that a business owner can tell her or his employees to help de-escalate a situation?
Sure. There are actually 3 easy steps that work almost universally on everyone. And they're easy to remember, they're easy to implement. When that person is showing those signs of anxiety or is starting to get a little upset, your employee, when they're engaging with them, should try to speak slowly. Really change the cadence of their speech so that they're speaking a little slower than normal. Lower the tone of their voice. And I know sometimes that's difficult to do with people who have just high-pitched voices, but really lowering the tone, dropping it down an octave, and then asking that person for their first name. And sometimes that might be uncomfortable, but asking, I recognize that you're upset. Could I get your first name? And then once they give you their first name, weave that into the instructions or the conversation a lot, almost to the point where it feels uncomfortable. So you're going to speak slowly, lower the tone of your voice, get that first name so you can make it personal, and repeat it often in your conversation. We're not trying to change your behavior for good. We're just trying to navigate through a difficult time as a customer entering that business.
Abby, what are some of the PPE that a business should have if they're dealing with the public? I mean, the face mask is obvious, gloves obvious. We've had conversations with businesses, I have just today, that they're having a tough time finding that. So a business preparing to open should be thinking ahead to just the basic cleaning supplies and personal protective equipment that needs to be present for employees and anybody dealing in the public.
Yeah, I think you hit on the important ones: the mask, the face mask, the gloves. But something that everyone really wants to see in virtually every setting is the employees inside that business constantly sanitizing those high touch areas, whether it's the door handle, the countertop, the tabletop, anything that a lot of people are going to touch. That's really what we want to do. I agree with you. Finding the appropriate PPE is going to be difficult, no question about it. That's something that everyone in the supply chain is dealing with. But I think doing the best that you can. And let's face it, it's going to be tough to wear a mask in a restaurant while you're eating, or impossible. But I think that's where you supplement that process with that 6-foot rule and really marking that out clearly so everyone feels comfortable. Because as you can imagine, people that are encroaching upon that 6-foot mark, that's going to engender some anxiety and maybe some conversations that won't go well.
Fantastic. All right, let's go back over to Jess. Jess, I'm going to ask you to pick back up and your thoughts when it comes to communication, especially after what you've heard Abbey talking about. What are some of those things that a business needs to be thinking about beyond the heart model as they start communicating this out?
Yeah, and to tie into what Abbey was just talking about with your employees, we are encouraging businesses to lead from the center. So often when businesses think about communicating, they think about clients and customers and external audiences first. But it is more important than ever to be leading from the center and making sure that whatever communication you're getting ready to deploy, you begin with your employees, those closest to you, those closest to the center, because these folks, they have anxiety as well, and they need to understand what's being in place. However, they're also great ambassadors for you. They're going to be the frontline folks interacting with clients and customers and guests and need to feel confident in what they're communicating. And while a lot of us may want to lead from the top and here's the plan, go forth and deploy it, we really need to have our employees on board because their anxieties, we need to make sure we're addressing them and that they're comfortable in the procedures we're putting in place so that they can go forward and be confident in how they're communicating them. I also really want to emphasize that businesses need to make sure that they are effectively communicating, I guess the answer to the question, help me help you. There are so many what we call solopreneurs or non-employer businesses, a lot of service businesses that may not be able to go ahead and provide curbside delivery right now. And there are customers that want to be helping them, but we don't yet know how to do that. Is that by buying a gift card, or is that by buying or keeping my reservation and just pushing it forward a couple months? So businesses, even the very smallest and the professional service providers, in some ways need to figure out how do you communicate to those clients, whether that's via your text or email or some of your reservation platforms, to let them know how they can provide help. Because I think the common thing that is tying us all together all over the world is this desire to help each other, but we need to be given the clear tools and directions and how to do that to support our small businesses.
So I think this question is mostly for Jess, but would also love to have Abbey jump in. When you talk about communicating to the customer as the customer walks in the door, so often we see signs. I can think of signs at eye level at Costco telling people that they needed to walk into the dairy cooler and one direction, there was an arrow on the floor, and come out on another side. And it's people they had blinders on and just were ignoring signs. So what are some ways, Jess, that we should word the signs, where they should be placed when we think about eye level, things like that, to do something to capture attention? How do we capture attention? And then Abbey, be thinking about where have you seen your signs work the best?
Yeah, this is a difficult one, but also such an important one. And I'll be really curious for Abbey's insights here. I would say brevity brings clarity, and recognize that even though we're balancing this overwhelm with exhaustion right now, who we're communicating with really needs kind of very basic, simple, almost repetitive instruction or content. I'm encouraging so many businesses that are wanting to send out long emails about everything that they're doing. It's like, it needs to be short. People are suffering from this overwhelm, and they need to be given very clear, specific, direct directions in what to do. And I would say from a signage standpoint, having multiple signs that are in a customer's journey through your through your retail, through your shop, through whatever your organization is will be helpful, but making them very direct and clear, and to Abby's earlier point, hopefully accompanied by a real human being who can provide that clarity to them.
The fewer the words, the better, the more straightforward, the better. That's what I hear you saying. Abby, anything that you've learned through this process?
Yeah, I tell you what worked best for us as a smiling employee standing next to that sign, greeting folks as they come in. We decided to use large signs with few words, make it very simple, write tight, give everybody the opportunity to look at it, and have that employee, if you can spare the employee, really talk to them ahead of time. This is all new for everyone. Put that smile on, even if you're having a tough time with it. And we found through our research, just in the last 4 weeks, what a tremendous difference that has made. One of the teams that I supervise are those frontline greeters, specifically at the Boise Hospital. And that smile, it's hard to see behind a mask. I'm going to tell you that right now, because all of our people have masks on. But I think instinctively, our customers who are coming in, they notice that the person with the mask on is smiling. And it's just that interaction that helps guide them through the entryway into the business, in our case, a hospital, and where to go and how to get there. Again, being as concise as possible in that communication model.
Let's talk about repetition of messaging from a communication standpoint, Jess, because I think as business owners, we say, hey, I told my employees, here's what you need to do. Stand out next to the sign, greet, make sure you smile. And then we're on to trying to keep the business alive in the midst of all of this. And we don't necessarily revisit or inspect what we expect. And the message might have gotten lost somewhere in translation, and we go back, well, I told you once. So talk about repetition and ways to repeat the message so that it gets through as we're all being bombarded with so much.
Yeah, there's that saying or phrase or data point that it takes 7 impressions for a message to get through to people from an advertising and marketing standpoint. And I would guess if they were to do that study again, we would see that we would need it even more during these times because of the anxiety level and the emotion that is almost filtering or coloring how we receive information. As a small business owner myself, I've definitely found as we're talking with our teams that we need to be consistently going back to the core tenets of how we're operating and how we're trying to keep them safe. So that means once a week, we are revisiting some of these key points and also asking for their input and encouraging them to restate and share what we're sharing so that we know it's almost been imprinted in the way that we've communicated to them. I like to teach the triangle model of 3 key messages for that core thing that you want to communicate. So I would encourage business owners to really refine down to what are the 3 most important things that your employees need to be communicating to partners, to stakeholders, to their customers, and hit on that perhaps in your stand-up or huddle meetings that you may have when you gather your team together, whether it's on Zoom or at a safe social distance, to make sure that they're remembering that and it is sticking into their brains.
Abby, anything else to add on that front? Anything you've experienced in training people on how to deal with this new normal?
Yeah, this new normal, it looks like it's going to be with us for a bit. I think that engagement with the staff prior to receiving customers is critical. Getting everyone in the right frame of mind and preparing to go down this journey, because that's what it is, of opening things back up and making folks feel as comfortable as possible as they walk in.
Okay. So I'm going to remind our viewers that we do have a Q&A box. If you've got questions that you'd like to have answered by our panelists, please enter those questions there. And Jess, you've got a slide for us to share some closing thoughts as we begin to wrap this up. Oh, you're muted. I'll let you know.
Oh, I was trying to get through a webinar without getting called out on the bingo for that. Okay.
Sorry, I know.
Let me go ahead and pull up some of the other things that we've been sharing related to communication, and particularly for leaders communicating with their teams. So I heard this phrase early on, a month and a half ago, of deliberate calm and bounded optimism. That right now, the communication we're looking for and the leaders that we're responding to the most are showcasing these qualities. That deliberate calm in the midst of this chaos that we're feeling, and the way that we communicate out. And bounded optimism is confidence balanced with reality. The fact that we're in these uncharted territories trying to figure things out together as we go forward. And that great communicators are in that space because people realize that there are tough times ahead and around us right now, and that we want some optimism that is based in reality. So all communication, we're really trying to make sure it is grounded in being calm and deliberate, and then that optimistic component. Leading from the center, as I mentioned, and Abby's emphasized as well, and having clear, credible, and consistent communication. If you are communicating with your team members, if you're communicating with your team members on a daily basis, on a weekly basis, stick to that so they understand when they're going to hear from you and hear updates from you. And being everywhere goes back to the fact that we're receiving communication in so many different places. And I may feel more comfortable going to somebody's website. Somebody else may want to go to your social media page. Someone else may walk up to the door of your business for information. So making sure that communication is across all of those channels so your customers can receive it.
So Lindsay Harris has asked a question in the Q&A box. And this one's interesting because I think it's going to help a lot of people. What is a respectful way that a consumer or citizen can request a business take more measures for public health and safety? Any thoughts on that? Either one of you. I'm looking at both of your faces. So Jess, it looks like you're ready to talk first.
I love that question. And I do feel that customers should be empowered to make that request. And it's almost like the way that you frame when you provide, say, critique to somebody. You share what you do appreciate about what they're doing first, and then you ask if they could potentially add additional precautions. So I appreciate that your staff was wearing gloves when they delivered that product to my car. However, it would make me feel more comfortable if they would also be wearing masks. Are they wearing masks inside the store? So I think it's framing a request with grace and understanding, which has kind of been in the back of my head these past few weeks. Grace and understanding and patience that we're all going through this journey together.
Abby, thoughts?
Oh, I think she used the right word, grace. We're going to have to get comfortable with saying to people, I don't like you standing so close to me while we talk, or you're standing too close, or can you please back up? We hear this at the hospital a lot. And let's face it, we have difficult communications with people that are very technical at times, but still we have to be willing to be open to someone saying to us, you're standing too close to me. And we have to approach it with some grace when we say to someone else, whether that's the employee or the customer, please, you're too close to me. Would you mind backing up a little bit? And that'll be something new for all of us.
And in that line, Angela is asking, how do you hold individuals accountable and address those who don't want to comply with the new practices? So that's what you would call a crucial conversation. And because it's not regulatory, this is not a law enforcement issue per se, but what are some recommendations?
No, this is a policy question and an internal policy. And that's where I really think having that meeting with the staff to say, this is what the expectation is, regardless of how you feel about it personally. Let's face it, there are lots of folks who feel like they don't need to adhere to these, wearing the gloves, staying 6 feet apart. But these are the recommendations. Again, not a law enforcement issue, a policy issue, and making that clear to the staff that a lot of people are going to expect that everyone understands. Back up, stay 6 feet away, and I want to see you with gloves and a mask on.
Yeah. We reached out to our employees as we were developing our return to work operational plan. And as a professional service, we'll be able to work from home longer, but we'll eventually, in some ways, return to the office in the next normal. And so as we're developing our policies, it's not only to set those standards for how we expect our employees to operate, but it's also to give them the framework to lean back on if our clients request something that they're not comfortable with, to say, well, this is what my company is choosing to do and how to operate. So no, we cannot have those face-to-face meetings. So we needed to provide that as well to our employees to give them the confidence in how they communicate out.
Lindsay asked to follow up, what can a business do to help facilitate the conversations or suggestions? And she asked specifically, is it a comment box that goes up? Is it opening it up to social media? Any other avenues that you recommend opening up the lines of communication?
And I'm assuming that's for clients and employees. We're talking both?
I think we'll talk both, just for the benefit of all those who are joining us. Yes.
Yeah, I think this is very interesting. And this is something that I've been thinking of from an HR and a legal standpoint. We're having very specific health conversations out in the open. And it's while we may talk in general with our employees about policies and practices, if there are specific health concerns, I'm making sure that those are funneled through the HR director. So even though we are planning and changing the way that our office is structured, we're trying to make sure that we're still maintaining confidentiality for some of those conversations. Related to customers, I would say all the channels through which you push out information to your customers, you should be prepared to receive feedback and information in return. And having a commitment to both monitoring and responding to what you're hearing is probably going to be the most resource intensive, but it can help really engender that trust and confidence that you're listening if you do commit to responding within a certain time frame to all the input that comes in.
Abby, are you able to share with us some of the ways that you're acquiring information and feedback from patients and people visiting the hospital?
Yeah, in addition to comment cards, we get lots of calls. And I'll tell you what, the ability to deal with things directly, almost immediately, because you could imagine if someone is stepping into your business and one of your employees has a cough, and we're in allergy season right now, it's going to change that experience dramatically. Not just through comment cards, not calls, emails, but being able to deal with things immediately. Because I think, unlike any other time in our history, people are going to bring concerns up emergently, right when they're happening. And I think being prepared to deal with them, whether it's an employee that's got a runny nose, a cough, or the perception that they're not feeling well, is going to be something you'll have to deal with immediately.
So we are in sensitive times, and this question from Kristen Jackson really exemplifies that. How can we, especially Main Street retail businesses, prepare for and respond to pushback and negative feedback or reviews on social media for opening too soon? And she puts "too soon" in quotation marks. So I'm going to set the context, and I'm assuming that the order has lifted and your business falls within the time frame for reopening based on recommendations from your state. But still, there will be people saying, no, it's too soon.
There's going to be a lot of people saying it's too soon in a lot of different areas. Let's face it, there are debates every day if you watch the news between experts. That's going to be a tough thing to navigate. And I think having a plan ahead of time, all of these safety steps that you're taking will address those concerns about opening too soon. We know what the parameters are. We know what the CDC guidelines are. We know what our governor and our mayor has said, and we're following those. And that's why we feel comfortable opening. We're not doing it too soon. Having that confidence ahead of time, a plan in place, safety measures in place, I really think that's how you'll get ahead of a lot of those concerns.
Jess.
Yeah, and to some of the tactical execution of that, because I can't agree with Abby more on what he just said, what it would be that really thinking through, I call it the questions that keep you up at night, going through the exercise of what are all those questions that people are already asking, or I fear they'll soon ask, and coming up with answers for them in a place before they're confronting you and you have the emotional response that we sometimes get when we feel attacked on social media. Getting those answers prepared. Also making sure that you have almost a clear statement of how and why you're opening. You're adhering to all of these guidelines. This is what you additionally have put in place as your small business, whether it's wearing gloves or masks and preparing and interacting with customers and products. Have that live somewhere on your website. And then when you have to respond or feel the need to respond to some social media questions, you can clearly thank them for their input and their interest in your business and link them to that site instead of getting in a constant back and forth in the commentary on social media.
Fantastic advice. Anthony is asking, what are your thoughts in asking and taking a customer's temperature prior to letting them into your business? Is that a step too far? And I know from a healthcare perspective, I guess I'm going to turn to Abbey as Jess thinks about how to communicate it. I'm going to turn to Abbey and say, I know as a business, hospitals, I don't know about your hospital specifically, but I know there are hospitals that are taking temperatures of people who are walking in the door. So what does that look like? How does that translate to a Main Street business?
Well, let me start by saying I am not a clinical person or a doctor, and I don't play one on TV. But I can tell you that that's something that we do at St. Luke's. Every employee, every visitor, every patient walks through the lobby, and there is a thermal scanner that takes their temperatures, looking for someone above the threshold that we've set. I think this is going to be an expectation virtually everywhere. I think large industry, airlines, movie theaters, those kinds of venues that are going to have lots of people, that's going to be a requirement. I don't think that's going to be something that's unreasonable to ask. I think the difficulty will be in finding those temporal scanners or thermal scanners, ensuring that they're calibrated correctly. With time, I think the supply chain will be able to bring those items to us. But I think in large businesses, that's going to be an expectation.
Jess.
I was listening in on a returning to business webinar earlier today, and this question came up as well around not just the logistics, but the legality of it. And can you demand and ask these things, particularly for businesses that aren't frontline, like hospitals? My other half is a first responder, and before he goes on shift, they are taking temperatures. I ordered one for my business just to have one, but to Abby's point, I'm like, how am I going to calibrate this? I'm not the expert here. I do not know what it would be like for small businesses to mandate that for if I'm not a Main Street business, for people coming in and out, or even for my employees. I do know that the expectations around staying home, even if you just have a minor cough, which previously we may have said, sure, come in and you can work at your desk, we're not going to be saying yes to anymore. Our standards for when people stay home, when they're exhibiting any sort of symptoms, are going to be much higher than they previously were. I think for a lot of small businesses, particularly in professional service, we're still trying to figure out where that line is with what we're saying people must do to enter the workspace. And that includes the temperature scans.
And it might be an easy way just to start with your employees first. I know a number of small businesses are checking the temperature of their employees. And I think it's just asking the question, and this, we want to help each other be healthy. It's starting with good intent. Have you been sick or been around somebody who has an elevated temperature recently? Can go a long ways as well. So we're about almost 10 minutes over time. We've got two quick questions I want to get to before we wrap this up. Jen writes, and they're both along the same lines. I'm a cleaning business owner. What are your thoughts about how to even start opening with families in the home? So this is about going into a home, and I think this is a communication opportunity. Jess, what are you doing as a business to make sure you're keeping the family safe? Linda follows up with a question. Can we take the temperature of people when we go into their homes? And I think that's probably a little outside the bounds for what we're talking about right now, but let's talk about the communication aspect of going into somebody's home as a service provider.
And I think as a service provider, you have that double responsibility of making sure they understand what you are doing for your entire employee base or you as an individual, and what everything that you're following to make sure that you don't have any symptoms, that you are safe and healthy and secure, and what you are then bringing into their home, but also the level of Q&A back and forth with your potential client, I think, is going to step it up a little bit. So the way that you may have gone through the process to onboard somebody whose home you would be cleaning, you may be adding additional questions related to how they are taking care to be safe and healthy in their interactions out in the world. I think it would be one of those things where there's going to be an expectation that you do wear the PPEs and the gloves, and you maintain your distance as you're cleaning someone's home. I think that as you're doing outreach to current clients, you want to reassure them of the steps that you're taking and what you've enhanced. And for new clients, as you're introducing yourself to them, if there are, I guess, professional and industry standards that you are adhering to at this elevated time, also communicating that will be key.
Okay, Susie just wrote this question. Can you suggest a list of questions that we ask our employees to ensure they are healthy enough to be at work? So Abby, you want to take a stab at that first? I don't know if there are questions that because you have a number of employees, not just in healthcare, but I'm thinking about janitorial staff, maintenance crews. I mean, you really cover the gamut as far as the employees that you have. Are there some good just questions we ask on a daily basis?
And we do, and they are changing on a daily basis. I think we're taking a lot of instruction from the CDC regarding their recommendations on what we should be asking. And again, changing on a daily basis. And I think having the visibility to that, which is relatively easy, is a wise step to take so that you can ask those questions about being sick, not feeling well. Are you around someone who is suspected to have tested positive or has tested positive? Those would be the to start with. But again, on the CDC website and even on the Idaho State website, there's a lot of good recommendations there.
Jess, anything else you'd like to add to that?
We've been deferring and looking to the CDC website and also the state's website for those types of questions and how they have been adapting. We also do, as essential travel opens back up in the coming weeks, we'll definitely be making sure we understand where people are traveling to and what, who and where they're interacting, so that we understand when they come back whether they are at heightened risk as well.
With that, Jessica Flynn, Red Sky Public Relations, Abbey Abbondandolo with St. Luke's Health System. Thank you both so much for a wealth of information today on opening our businesses and communicating the right way as we do that. You've given us some rich tactical advice on how to do that. This webinar has been recorded and will be posted so that you can go out, rewatch and capture any information that might have slipped by too fast. Also, once you see this populating on Facebook and YouTube, if you'd share it with other business owners, we're sure it could be a big help there. There are a number of resources for businesses around how to survive and ultimately thrive through this time. Go to bbb.org to find that. And we'll be back here tomorrow with another webinar, same time. And if you can find the registration page on the same place you found this registration page. Tomorrow, we're going to talk about how to get your business online to sell. There are a number of turnkey platforms and solutions, and we're going to take a look at about 6 of those solutions and help you start to ask the question as a business owner, if you're looking to sell online, what are some of the best ways to do that? That webinar is happening tomorrow. With that, this is a Better Business Bureau webinar, Building Trust in Trying Times. Thank you again to Jess and Abby, our guests today, for some terrific information, and we wish you a fantastic day. We'll see you back here tomorrow.